So welcome to the closing plenary. It's been a lovely morning, been a lovely afternoon, or maybe a lovely evening, depending on where you are in the world, and we're delighted you stuck with it. As you can see, as people continue to filter in, we've got over 75 people who've been part of this discussion who are here now for the final, the capstone of what we've been doing today, and we're delighted to have you. So this closing plenary, really about where we've been and where we're heading. And we really are delighted to have the investment of all these panelists and moderators and participants from around the world. And really, you know, I had the advantage, I guess I mentioned to most people not to jump around to different roundtables. I kind of didn't take my own advice. I just wanted to hear a little bit, but it was really wonderful to hear from the different panelists and that so many of you decided to leave your own input in shaping as we move towards having real solutions for these serious challenges that we're facing in our homes and in our work, and definitely as we seek to support and treat patients. So without further ado, we're delighted to have Dr. Felicity Mehendale. She's a plastic reconstructive and cleft surgeon, and if I can close my chat here, she leads the Global Cleft Research Program at the University of Edinburgh. She's chair of Cleft 2022, which I'm sure we've all learned about, and president of the ICC-PCA. And her research includes applications of AI to cleft outcomes, cleft epidemiology, perioperative and neonatal care products, and equity of access to cleft care globally. I think in the cleft palate surgical roundtable, I heard her sharing a little bit about a research project she's also involved in around the impact of COVID on cleft care. So lots to commend, and it's been lovely to have her as one of our international advisors. But without further ado, I'm going to pass the floor over to Dr. Mehendale, who will share a presentation entitled "Looking Back, Moving Forward, Learning from COVID to Make Cleft Care Better."
Hello, everyone. No, thank you very much, Hugh. It's been a huge honor, and I don't really feel qualified to be speaking here. I've learned so much today, and I can't possibly do justice to the fascinating conversations and discussions that have been shared. And I know Hugh said that we will be sharing a report about this. So this is really just to give some reflections and a bit of a perspective on maybe where we go next. And most importantly, what can we learn from COVID to make cleft care better? Next, thanks, Hugh. As Hugh said, I'm based in Edinburgh, which is in Scotland in the north of the United Kingdom. But the first half of my life, next please, Hugh. The first half of my life, I grew up and trained as a doctor and surgeon in Mumbai. Next, thanks. And I'm honoured to be speaking on behalf of all the advisors with whom it's been a huge pleasure to work on this project. And I know Hugh will thank the moderators and panelists and all the participants for such valuable and stimulating discussions. But I just wanted to say to Hugh, Neeti and the team, what a fantastic job they've done. And it's been so well organized and the planning's been fantastic. And I think Kiko Chat's brilliant. So next, thanks. Hugh and the team sent out a survey that I'm sure some of you will have answered. And there's just 2 slides I wanted to share from that. The green box on the left of your screens is a summary of responses from low and high income countries. Middle box is low middle income countries, and the right-hand box is high income countries. And the concerns, the challenges are relatively similar, very much focused on reduced numbers of patients presenting, patients frightened to present, and of course the knock-on effect of dealing with the backlog. And then of course something that's been a constant theme throughout today is the internet access and the ability to deliver telecare. Next, thanks, Hugh. There was also a question on areas of interest for cleft clinicians. And again, there were similarities with virtual medicine, not surprisingly being telehealth being the top area of interest. But then there was a little bit of a variable response with, as you see, number 2 in the LMIC group, self-care for health professionals. Interestingly, that didn't feature in any of the top 5 in the high income countries. And that sort of made me think about a few things, and I'll come back to that later. Next, thanks, Hugh. So going on to a backlog, we've heard a lot about this, and there's many reasons why the backlog has accumulated. I won't go over those again. I think we've all talked about them and are very familiar with them. Staff health also impacts on this, and PPE availability impacts on this. And the challenge is how we get governments to prioritize cleft care. And I think our voices as an international group of clinicians are really, really important for us to identify and agree and lobby for minimum standards of care for babies with clefts. And more importantly, look strategically at how those aims of ours for our patients fit in with strategic goals such as the Sustainable Development Goals, to which governments are more bought into. Next, thanks. And I think COVID has come along and absolutely shone a bright flashlight on the fundamental weaknesses of healthcare. And it's challenging dealing with a highly specialized field such as cleft care when some of those fundamental issues still remain. Despite that, it's hugely inspiring to hear the innovative approaches people have taken, the huge commitment people have had to delivering care, even if it means at risk to themselves. And I think it's hard, I think, for some of us in countries where we don't face some of those challenges to visualize how hard some of these things have been. In particular, I think one thing that struck me was the difference in the approach to healthcare workers. In the UK and in a few other countries, they've been appreciated more than they've ever been appreciated before. Yet, I think Sarah hit on it so succinctly when she talked about how healthcare workers had a stigma. And I think she used the word, they were soiled. And I just felt so sad to hear that. And I wonder if that's had some play into the worry about self-care being number 2 on LMICs and not featuring the top 5 in high-income countries. And that's with me being aware in high-income countries of us saying we do need to pay more attention to how well we treat each other. So I think that for me was the biggest discrepancy in the survey. We've lost some text on pandemic preparedness, but I think there are lots of things that high-income countries must and should learn from low-income countries. Oh, next, I can't do next. Can you? And it feels like it's taken a pandemic to highlight what to many of us we intuitively knew was best practice. But what COVID has done is, in a very sad way, it has generated evidence to prove and demonstrate it, to prove what happens when you can't get nutrition to your patients, like Dr. George talked about. And many of us, our patients and our colleagues, have paid a high price for this evidence. So we have a duty to make the most of it and use this to improve cleft care going forward. Next, thanks. So I think there are some silver linings. I think I've seen more openness and more sharing of experience, more willingness to say I don't know things. And that certainly was the ethos of this conference. There's been so much more in the way of online teaching and webinars. And I think certainly within the UK, there's been more kindness within healthcare. And I think there are things we can learn to try to make cleft care better, be better prepared for the next pandemic, and also make sure we do not lose all the good innovations that people have just made happen far, far faster than they would have if COVID hadn't occurred. Next, thanks. And that's all very well, but that's probably easier said than done. Particularly, yes, we're all trying very hard, we're all doing our best, but there is still a lot of uncertainty and we genuinely do not have answers. So it's not that easy to pinpoint and say that's best practice. And that's where a group like this is so important, that we do share, we do collaborate, we do find meaningful answers. And a quote, next, thanks, Hugh. A quote I like very much was by a journalist and broadcaster in 1995. And I first heard this when Mike Mars said it, that everyone is a prisoner of their own experiences. And I think it's up to us to work together to make those prison walls fall down or be as wide as possible. And I think one thing we have in 2020 that they didn't have in 1955 is we don't have to rely on a telephone. We can Kiko chat and we can Zoom. Next, thanks. So a few thoughts on what I think, and this is just to stimulate discussion, needs to change. I think internet access is crucial for telecare. It's crucial for delivering care. It's crucial for us to learn, to share, to carry out research. And I think the increased use of telemedicine is here to stay and will be a good thing and has happened quicker than it would have without the pandemic. But without universal access, this perversely will increase inequities. And that's something we need to lobby to not let happen. And there's ways we might be able to pin this to other strategic goals. Next, thanks. And I think bureaucracy. Certainly within the UK and the NHS, things take a long while to change. And I don't think that's specifically unique to the UK. All countries have it to some degree. And yes, there is a danger of knee-jerk responses that are not well thought through, but we have seen things move a lot quicker to make change. One area that I've had some experience of, because we were working on a new device to try to trap aerosol, is the bureaucracy around medical device regulation, but how that has been speeded up to allow for increased demand for PPE and ventilators. And there must be a happy medium somewhere. And two other things that I think cause unethical barriers to research is the time it takes to get research approvals. I'm part of a working group at the Royal College of Surgeons where we look at what research has happened in response to COVID, how has it been prioritized, and there's some countries who have been able to participate in international studies and some who haven't, purely because there is no international consensus on what requires ethical approval, what doesn't, what is an audit, what is a service evaluation. And I think as an international group, we need to agree some standards around that. As I say that, but we don't even have agreement across the different health boards in the UK. So I think those are things that do need to change. Next, thanks. I think the knowledge sharing has been a fantastic development that's happened. I do think we could do a better job of coordinating research and teaching and minimizing duplication. COVID, there are some web platforms where you register your COVID reviews and your COVID projects, but I think we need to learn from that and do that in Clefts so that two people aren't working on the same project in competition rather than in collaboration. I think journals have tried to make peer review quicker with very varying success. Some have been quick and some have been very slow. In the physical sciences, physics and engineering, preprint servers are very commonly used. That means you put your article up before peer review, the press gets hold of it, the world gets hold of it. And I think there's a role for that, but I think Puneet made a good point about people jumping onto research before it's been adequately peer reviewed. So again, a challenge to find a good balance there. Next, thanks. And PPE, again, I am not going to repeat the points that people have made so eloquently today. I think the one thing I do want to talk about is the really excellent comment Sarah made, that it's one thing to have enough PPE, one thing to have the right level of protection, but it still impacts on the wearer, not just comfort and communication, but actually safety. It stops you communicating with your patients, and speech therapists have found innovative ways around it. Within the UK, we have a surgeons WhatsApp group that shares tips and ideas and challenges of operating with PPE. And the practice run is so important, as Sarah said, because these are unexpected things that could hamper us and compromise safety. Next, thanks. And I do like the concept of Build Back Better. I'm slightly annoyed that it's been hijacked by politicians, but I was reassured to find that it was actually first used in 2015 at the 3rd UN World Conference on Disaster Risk Reduction. And this was in Sendai in Japan. And Prime Minister Shinzo Abe said, while this may seem like a new concept to the rest of the world, This is something Japan is very familiar with, building back after disasters. And it's actually a part of our culture, he said. So I think we can all learn from that. And I think high-income countries, we need to learn from our LMIC partners, because we do not know enough about managing and building back from pandemics. So we all need to learn from each other. Next, thanks. And I talked about thinking how we can push for better cleft care, influence policy, but clefts are a tiny proportion of the many global problems that need universal health coverage. And I think we need to think strategically about how to position cleft care and how best to make our voices heard to change things. And next, thanks. And clefts, and that's relevant to the Sustainable Development Goals that were adopted in 2015. And certainly if we had those in place and had achieved those today, COVID would not have had the impact on cleft care or any other healthcare that it's had thus far. Next, thanks. And instinctively, we all might think goal number 3, good health and well-being, clearly that matters, that ticks the box for clefts. But actually, all the goals are interconnected. We cannot look after our babies with cleft if we haven't achieved goal number 1, which is no poverty. We haven't achieved goal number 2, which is zero hunger. And if we haven't got good education and internet access, again, we compromise cleft care. So I think there's some work we need to do as a cleft community, speaking together, framing what we need for our patients with clefts within the bigger aspects of Sustainable Development Goals and universal health coverage. Next, thanks. Thanks. And just for perspective, on the y-axis here is a percentage, and this shows the proportion of countries with insufficient number of healthcare professionals. About 40% of countries have less than 10 medical doctors per 10,000 population. Almost 60% have fewer than 40 nursing and midwifery personnel per 10,000. And most worrying of all, almost 64% have fewer than 5 dentists per 10,000. So we need, it's quite a challenge to deliver highly specialized care when some very basic primary care is difficult to achieve. Next, thanks. So looking beyond COVID and trying to make the best out of what the situation we're in, and as my mum says, to find the silver lining. I think there's a lot we could do to link cleft care with bigger goals like universal health coverage, addressing inequalities, and the Sustainable Development Goals. And I think we really do need to agree on minimum standards of care if we are to have any chance of influencing policy. And most importantly, not go back to where we were. We've innovated and made such a difference at a fast speed. So we need to capitalize on that. Next, thanks. So I see this conference as bringing together silos of really special knowledge. Next, thanks. And us joining together, bringing experience together. But I think it's days like today that achieve the next step. Next, thanks. With apologies to those who don't like cats, but I think that's the power of us coming together. Thank you all. Next slide.
Very good. Well, that was a whirlwind, Dr. Mahendale. Thank you very much. I know you're an active participant all the way along, from being an advisor to in the various roundtables to bringing in some insights from your colleagues this morning in the opening plenary. I think it's a great place to stop. And obviously, this is not a stop. This is the beginning of a much wider discussion. You've pointed to some really big challenges for how, personally, as we work as NGOs and support our partners in LMIC, talking about how teams work and pursue comprehensive cleft care in continents around the world, and as we all respond to the challenges of COVID in our own personal lives, as well as in our work. There's so much there that requires this kind of collaboration that you're talking about, and this concerted effort to build on the innovations. And again, yes, I think that is the right phrase, build back better. And it's reassuring to me that it's not just politicians now that have initiated it. This is something that goes back to a country. We don't have any participants, I don't think, today. We're located currently in Japan, but for a country that went through an experience of devastation and did indeed move forward. So quickly, I know we're at the end of our time, but I just want to give out a special thank you to our moderators and panelists. This was a ton of work. We were asking them to participate in a brand new platform called Kiko. We were asking them to present on things that they hadn't published on or hadn't refined over years. We asked them to present in a very short amount of time using technology. We asked a lot, and this is the expression of care that they have for you, the global Cleft community, that they did this, and we're so grateful. Really, it's across NGOs and it's across countries, and it was really some insights that are hard won from experience on the ground delivering comprehensive Cleft care that we benefited from. So, again, please find that reaction button. Let's hear it silently, but let's hear it for our panelists and moderators for making the heart of today so exciting. And not to mention, of course, Dr. Mahendale, Professor Rupa, and Dr. Sarah earlier. This is a phenomenal team that really brought things together quickly and produced an amazing experience that I learned a lot from. I don't want to also stop mentioning in particular the Circle of Cleft Professionals, but in particular, Smile Train, Operation Smile, Global Smile Foundation, Transforming Faces, whose staff have really been working behind the scenes to make sure that this worked really well. We want to give a shout out to Kiko Chat and Lucas, the founder, who's been really responsive, especially working closely with Niti in building out the environment that we've experimented with. Obviously, there's a lot more that can happen in this kind of space, but we wanted to give people at least a taste of what could happen. I know I was chatting with Dr. Per Hall about how we can make the coffee room better. Next time we're on it. We'll think about ways of making it there, and definitely had some requests for tea also. So maybe we'll rename that for next time. But definitely, a huge thank you, and especially to the core team for the S4CCC, Niti leading. We had Rachel, Abdon, Courtney. Thank you. Well, we really couldn't have done it without you, and this was a lot of late nights and making this happen, and I'm so grateful. So what's next for all of you? We do have a really important feedback survey. It should be in your inbox right now. Please, let me look really closely. Please fill it out. It'll take you like 5 minutes maximum, but it will definitely shape what happens next. So if you could please carve out time, even while it's fresh right now. I mean, I know in the Philippines it's midnight, but if you could take out 5 minutes right now and just while it's fresh, give us your feedback, give us your rating, tell us how we can improve, tell us what we did well. That will really help shape what's going on. This Kiko Chat environment will continue to stay open. So we're not going anywhere. We're going to end the plenary in a second, but stay on, go to the coffee room. You can chat with people you met, you didn't have a chance to catch up with. It's not just a 5-minute break, it's open. But also if you have other comments or questions that came to you and said, I didn't say this in the roundtable or it wasn't part of my roundtable, but I'd like to have this in the record. Please go on there. There's a space for comments and questions. You can add to someone else's. You can like what they've said. We'll see how this works. And then definitely we're committing as a team to bring together a conference report, roundtable summaries, publish these roundtable recordings, assuming technology held up, and then also to provide to you participant certificates. So we know that you helped as participants to shape the learning and the knowledge that happened here. We want to acknowledge that both in the written report of the summary of the roundtable, but also in a certificate that you can use professionally. Those will come out within 2 weeks, all being well, so Friday, October 2nd. And then finally, please continue to send us feedback and recommendations. And also, if you're involved with an NGO, let them know what you appreciated about this, because again, the Circle of Cleft Professionals is what made this possible. So that brings me to the end of my part of the presentation. Thank you so much for joining the Circle of Cleft Professionals inaugural S4CCC conference. We hope by saying inaugural that it might happen again or something similar will be built upon. But this is the end of the plenary, but please feel free to stick around. Go to the coffee break room and chat with some colleagues, or if you've had just enough Zoom, you have my full permission. Turn off the computer, walk away for a while. If it's night, go to bed, get a good rest. You'll need it to keep battling COVID. And for the rest of us, just know of our gratitude. And thanks everyone again.